are in attendance, and welcome if it's the second time we've had this conversation today. We do invite you to ask your questions using the question form here on Microsoft Teams. And again, if you could indicate your name, your media outlet, and who your question is directed to. Welcome also this afternoon to viewers who are joining us on Rogers Television, as well as the Rogers YouTube channel and Facebook page, listeners to Global News Radio, AM 980 CFPL, and those tuning in on the CTV London website. Well, let's begin with opening statements from Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. I'll start with an update on weekend bylaw enforcement, and unfortunately, there were a few incidents where fines were necessary. In speaking with the head of bylaw enforcement, I understand one restaurant owner was charged the maximum $880 fine for not ensuring that employees and patrons were properly masked. As well, numerous violations were observed at a local tavern during a live music performance. These violations included no barrier between the band and audience and inadequate separation between tables. I'm told charges in that case are pending. And I'm sharing this as well to give the general public the strong sense that that this is being paid attention to, and I think that the public needs to be made aware. In more positive news, our bylaw enforcement officers observed no issues in local rinks and arenas over the weekend. We also had staff out in a number of malls, again over the weekend, which were quite busy. No fines were issued there, but our people did issue a number of warnings to people who had taken their masks off to eat or drink while walking between stores. That kind of thing can only be done in food courts while seated at a table. So that's why warnings were given to individuals. So you can't walk and eat. You can sit in a food court and eat, and that we want to be clear that that's the direction and those are the rules. Because you know what? We know the stakes are incredibly high, and especially right now, and there's so little margin for error. Anyone requiring proof of that just look no further than what's going on in Toronto and Peel. As we know, they're into the first day today of a minimum 28-day lockdown. What does that mean? Well, almost everything is closed in those two regions, save for essential services and schools. And we know that these decisions are made by the province, but I'd rather we make our own decisions right now to ensure we never come close to reaching that point. After 69 cases in just 3 days late last week, we've since registered about half that total in the most recent 3-day period. We continue to see plenty of fluctuations in the daily case counts, and because of that, it's still well within our ability to control. We can be proud of the fact that London Middlesex continues to have one of the lowest case counts per capita of any medium to large-sized city in Ontario, while at the same time recognizing the need to drive those numbers lower. Even with our numbers today, we're still seeing patients wind up in hospital, and sadly, we're still seeing people lose their lives. So let's continue making the right choices of London in our particular own day-to-day activities, listening to public health officials, especially Chris Mackie, because I like listen to him like all the time, but equally doing all we can to not only protect ourselves, but also each other. Over to you, Dr. Mackie.
Thanks very much, Mr. Mayor. I think if you look both locally and provincially, the numbers that we're seeing are quite high, but they're actually steady for the last week or so. And compared to the skyrocketing cases we've seen previous weeks and in many other places across Canada, I think that's something that we need to be proud of. And I want to thank folks once again for doing what they can to keep their distance, minimize contacts, wear a mask. The things you're doing are making a difference and it's paying off. If we can keep at this level of disease spread for the coming months as we lead into a vaccination being available, that will really make a difference in preventing the deaths that we saw in the first wave. We do have one new death today, a person in their 70s. Very unfortunate situation. Fortunately, those numbers are staying relatively low locally, and we hope that that continues. Dan, I'll pause there. Happy to take any questions.
Thank you, Dr. Mackie. Thank you, Mayor Holder. Well, we do have some questions in the queue, and again, a reminder to the media joining us this afternoon, if you could ask your questions using the question form here on Microsoft Teams and indicate your media outlet as well as your name and who your question is directed to. Let's begin, Dr. Mackie, a couple of questions for you. from Ilan Peterson at the Western Gazette. Dr. Mackie, are there any new cases related to the Perth outbreak or the Saugeen outbreak?
So for the Saugeen outbreak, we are up to a total of 9 cases in that facility, 1 case outside of that facility that is linked to that same outbreak. For the Perth Hall outbreak, no new cases. There is a total of 3 cases associated with that outbreak.
Right, and a couple of follow-up questions here, Dr. Mackie. Elan would like to know if the Perth outbreak is linked to the Saugeen outbreak, and do you happen to know how either of those outbreaks originated?
Yeah, we don't have conclusive evidence about whether Perth and Saugeen were linked, and unfortunately we don't have a source for either of those outbreaks.
Safe to say that the investigation into both those outbreaks is ongoing, and we're still in the early days of both of those. And finally, Dr. Mackie, is the MLHU investigating the Delilah's video? This again from Ellen Peterson at Western Gazette.
So what we're doing right now, MLHU is working with the staff at Delilah's to make sure that when that facility reopens, it does so safely and that all protocols are followed. We appreciate people sending us information like this video. We get lots of tips, probably dozens every day, that help us to identify where issues are in the community. And that really makes a difference in terms of making sure that businesses and customers can act safely.
Thank you, Dr. Mackie. Let's move on to our next question. This one is from Jennifer Beeman at the London Free Press, and it is for you, Chris. Dr. Mackie, how many cases have been linked to the 2 outbreaks at University Hospital? How many are hospital staff members?
At this point, we have 23 cases linked with the 1 outbreak at UH and in another 6 cases. It's on the 9th floor, but 6 cases linked with the other outbreak. So we're at 29 cases between those 2 outbreaks at UH. The majority of those cases are in hospital staff.
Okay, there we go. Thank you, Dr. Mackie. Let's move on to our next question. This one comes from Steve Young at CTV News and News Talk 1290 CJVK. Dr. Mackie, I would like to know your personal opinion on Toronto and Peel region re-entering the lockdown mode. Do you think we need to follow the same suit in London and Middlesex County in order to get past these double-digit increases we've been experiencing in this region?
Well, I think that it's fair to point out that most jurisdictions who have been able to suppress a pandemic wave, first wave or second wave, have had to resort to a lockdown of one sort or another. And that said, we really do have the goal of minimizing death as our number 1 goal. And we're seeing seven deaths over the past September, October, November, so almost 3 months now of the second wave. The rate is far, far lower than the first wave. And I think that the restrictions that we have in place are making a huge difference in controlling the spread and reducing deaths. Whether we have to go to a lockdown in order to keep numbers as low as possible prior to vaccination is really, I think, an open question, and a question where our society has to decide about what's an acceptable level of spread. And I think the government framework that we have really points us in the right direction there, puts restrictions in place that will limit spread without completely locking down. So if we continue on at the current rate, we won't necessarily see more restrictions. If our rates continue to rise, we likely will. And it's not clear at this point whether we will have to go back into a sort of a modified lockdown before a vaccine arrives.
Dan, you're
Sorry,
on
Dr.
mute.
Mackie. Yes, thank you. Some important things to consider there, particularly as we head into the winter and also towards the holidays as well. All right, let's go to the next question, Dr. Mackie. This is from Jennifer Beeman. Dr. Mackie, are there any details you're able to provide about the latest death being reported by the health unit? What was their epilink? Was it outbreak, close contact, travel, or no known link?
Yeah, that individual was associated with a cluster of cases. We're not sharing any additional information at this point in order to protect that individual's personal privacy.
Thank you, Dr. Mackie. And to the media who are tuning in, if you do have questions, please let us know, and you can submit those. Again, if you can indicate your name, your media outlet, and who your question is directed to. We do have one question, and it's a question about if we have additional information about the restaurant that was charged this weekend. Mayor Holder, do we have information on that, of what charges would be pending there?
At this point, because the charges are pending and have not been laid by police, this was a police review, not our own staff. So until that's been confirmed, right now it's under investigation. So because it's pending, we're not in a position to declare. But clearly, when that is done and the charges have been laid, then I think we'll be more forthright with that.
Thank you very much, Mayor Holder. Well, thank you both. That actually brings us to the end of our questions for today. Mayor Holder, Dr. Mackie, thank you for your insights. Thank you for your time. And we do appreciate you sharing your information with us. The next virtual media briefing is scheduled for this Thursday afternoon at 2 p.m. We hope you'll join us then. Between now and then, have a great rest of the afternoon and take care. So long.